Mamas, choices, choices, choices. You are pregnant and you have so many of them, and you probably think a lot of them are for what you do after baby arrives. But I'm here to tell you there's a lot that happens during pregnancy and a lot of choices for birth too. So we're diving into it in this series. If you're interested, tune in. Hi everyone, my name is Leslie. I am a disciple, wife, mom, and childbirth doula, and this is my channel where I share about all things birth, faith, and family. Let's dive right in because we are in the middle of a choices video going through all the choices that we have during pregnancy, birth, and postpartum. And today we are talking about choosing your support, choosing your care provider. So we talked about last time about how important it is to get educated and figure out what your vision is for birth. Now today we're going to talk about how to find a provider that fits that vision for you. And I've just got 3 tips for you today. So I'm going to keep it short and sweet. Number 1, interview prenatal care providers, more than one. You do not have to, just because your whatever restrictions may be around depending your medical insurance, your coverage, whatever it is, you still have options, you still have choices. And so I recommend taking some time, go on any of the search online for some OBs in your area or some midwives in your area. I would recommend interviewing both. There are certified nurse midwives you can go with. It just depends on which state you're in, what all your options are, but don't feel like you just have to go to the place where everybody else goes or where you happen to be getting your medical care. Now, take some time to have a couple of meet and greets so that you can get to know the care providers that you get to choose from. And if you need some guidance on what kind of questions to ask, I will include a link down below to a resource that has questions that you can ask a potential midwife or OB, good guiding questions for a conversation with them. It will depend on what you're looking for, right? If you're looking for a vaginal birth after a cesarean, it's important for you to ask this potential care provider what their success rate is with VBACs. How often, what is their cesarean rate? Things like that are important to ask, and most doctors do know. If they don't know their own personally, they could at least let you know the statistics for the hospital where you potentially will be birthing, or the birth center, or wherever it is. You can ask these questions. The worst that can happen is that they could tell you that they don't know, right? And so these are a couple of, depending on your vision, you will have specific questions that will mean more to you and will be important for you. But I think the biggest one is asking, what is your philosophy about birth? And if you watch my last video, I'll link it here, you'll have some guiding questions that I've already recommended you to go through, right? A little bit of exercise that you've gone through to determine what you believe your philosophy is. And it really does make a difference when your care provider, not only it's really important when your care provider agrees with your vision. Not doesn't just agree with your vision, but also has the same beliefs for birth. When you hear them speak about their philosophy for birth and it resonates with what you believe about birth and what you're hoping for in this birth. And so that is why I think that is why my last video was about what your vision is, because it will help you so greatly in finding a care provider that aligns with your beliefs. Now, I will just put here tip number 2. There is a difference between tolerance and support. This is my tip number 2. You don't want tolerance, you want support. You don't want someone who is willing to put up with your desire to want to have a VBAC, but you want someone who supports your choice to a VBAC and actually believes that you can do it and wants to help you reach that goal. That's what you want. You don't want somebody who says, yeah, it's okay for you to try to go naturally, but if you don't go into labor by 40 weeks, then I'm inducing you. That is not support. That is tolerance, but that is not support. Your care provider is your care provider. They are providing you with care. Believe it or not, mom, when it comes to birthing your baby, you are actually the expert, because you are the one carrying the baby. And when the process starts, you are the one who is able to really know what's going on. And this is why education is so important, so that you feel empowered when you go in. And even if it's your first time, even if you're like most of us are, the first time we're kind of like, wait, are we really in labor? Doesn't matter how many times you've seen labor. I still went into my first labor being like, nah, this isn't it. And continued to just move on with my day. But still, even in that, you can equip yourself with enough knowledge that you feel confident going into birth. Like, I know I can do this, and I know that my body knows what it's doing, and it's trusting the process. But that has to do with education. That has to do with getting informed. That has to do with research. And so I encourage you, to do your own research and figure out what you believe about birth. But then also, when you're looking for a care provider, do not just accept tolerance. Get support. Get a supportive team behind you. And if you feel like, this brings me to tip number 3, if you feel like you're in a situation where you do not have a supportive prenatal care provider, then I encourage you to consider one. Believe it or not, it's really never too late. You can change providers, even up to, I've seen moms change up until 35 weeks gestation. And so 35 weeks pregnant, and changed providers because she did not feel supported in what she wanted to do. And so I will say that. And I know that there are facilities that will gladly accept people up until that time, even though it's really close to when they're giving birth. And so I don't want you to be discouraged. If you feel like, Leslie, I am about to give birth like tomorrow, and now that you're talking about this, you're saying things that my doctor has said, and I'm starting to think maybe they're not as supportive as I thought they were, right? That's okay. That's okay, because the beauty of this is that it's a team, right? And while your OB is a part of your prenatal care provider, there will be nurses there, and there will also be your support team. And that brings me to one of my upcoming videos will be on if you'd like to choose a doula or not, because that's a choice. But also who you bring as your partner into the room to help support you. That's also a choice. You want to have support around you, people who believe for what you're believing for. And that is why finding an OB or a midwife who believes in what you believe in, who doesn't want to use interventions on you, who will try to let you go as long as possible, as naturally as possible, if that's what you want, then that's important to do. If it's not what you want, then just confirm that the things that you do want are the things that your prenatal care provider is in agreement with, is saying, yes, I support that. Yes, I'm in agreement. Yes, I will be there for you in that, right? And so that's why it's so important. Determine your vision and choose your support. So that's it for this video. I hope that this has encouraged you to go out and do some research about who your prenatal care provider will be. Will it be an OB? Will it be a midwife? Which OB will it be? Which midwife will it be? There are so many options out there. I encourage you, again, number 1, interview. Have those meet and greets. They're complimentary. They're normally 15 to 30 minute long conversations or longer, but they'll block out at least 30 minutes to have a call with you. Even if it's like a group of midwives or a group of OBs, they will have one person meet with you and have a call with you and answer all of your questions. Take advantage of that. That's number 1. 2, don't accept tolerance. Look for true support. And number 3, it's never too late. It's never too late to get support, to get some support in that room. If it's not your care provider, make sure it's the partner that you have in there or a doula for support. I hope that this is encouraging to you. God bless you all. Please let me know below. How did you choose your care provider? Did you feel like it really wasn't a choice and you kind of just went with it? Would love to hear your thoughts in the comments. Looking forward to seeing you in the next video. God bless you. Bye.